Hello, I'm Tracy Nau, and I'll be sharing some of what we've been doing as part of the ASAPA project to build awareness and understanding of systems approaches to physical activity in Australia. Physical inactivity is a long-standing problem in Australia for which there is no simple single solution. There's a growing recognition that systems approaches are valuable because they enable us to tackle complex problems from different angles, engaging the many sectors that can help society to be more active. There have been attempts federally to take a systems approach to physical activity. In the years leading up to the year 2000, there was a period of intersectoral policy planning for physical activity. However, these efforts were disbanded following a shift in political agenda. Recent developments have created a renewed opportunity to consider systems approaches in Australia, and these include the World Health Organisation's Global Action Plan for Physical Activity, Sport 2030, Australia's first national sport plan recognising population physical activity as a goal in its own right, and actions in several states towards a more intersectoral approach to health and well-being. To support a systems approach to physical activity, the ASAPA project firstly set out to map and understand the existing landscape in relation to adults and in relation to 3 Ps: prevalence, policies and programs. In relation to prevalence, we wanted to understand how jurisdictions are measuring population physical activity and how they differ between them and over time. In relation to policies, we wanted to understand how physical activity is being addressed across different sectors and jurisdictions. And in relation to programs, what are the major ones and the large-scale interventions for physical activity in Australia? On a broader note, we're also seeking to foster systems thinking approaches in Australia and an understanding of what can be done collaboratively through policy to improve physical activity. To start with, we brought together policymakers from around Australia and diverse sectors to share information about the 3 Ps, and these forums revealed some awareness about systems approaches, but limited experience in using them. We've continued to engage with our stakeholders, primarily through a project working group comprised of a subset of those meeting attendees, and they advise us on our project outputs and they help with the dissemination and uptake of project findings and recommendations. We're also continuing to engage with NPAN, an informal cross-government network for policymakers with an interest in physical activity. In relation to our mapping work, we found that most policies treat physical activity as a co-benefit of addressing a different goal, such as to improve livability. There was considerable attention towards creating more active environments, with much of the policy action directed at the planning and transport domains. However, some areas need greater attention, in particular more specific measures of evaluation, clearer funding arrangements, and greater consideration towards independent governance and oversight. Programs were mainly aimed at the sport and recreation domain. Many programs overall were funding related to support the delivery of programs by others. And unlike the policy audit, we found far fewer transport, environment and planning interventions, raising some questions about the extent to which active environment policies are actually being implemented on the ground. Our findings also suggest limitations in current evaluation practice and limited program reach on the whole. In relation to prevalence, we found considerable variation between jurisdictions and within some jurisdictions in the sorts of definitions and survey questions used to determine the proportion of population meeting physical activity guidelines. And while changing guidelines have also made it challenging for jurisdictions to report against them, these variations make it very difficult to compare jurisdictions and monitor trends over time in order to understand the true impact of policies and programs on the population. From our mapping work, we've since developed and launched an evidence-based guide called Getting Australia Active 3 to support a systems-based approach to physical activity. This guide has been written for policymakers in Australia and covers different policy domains, supplemented by illustrative examples to help bring the evidence to life. This guide also presents a conceptual systems map for physical activity to help frame an overall understanding of systems approaches to physical activity, identify potential intervention points, and focus attention on important areas often overlooked, including governance, resourcing, and evaluation. To sum up, Australian policy for physical activity has had periods of advancing well, but then faltering as a result of shifts in political agendas and priorities. Recent developments have created a renewed opportunity for using systems approaches for physical activity, and they coincide with some state-based efforts to pursue more intersectoral approaches for health and well-being. Our project has adopted a collaborative approach with policymakers and taps into existing physical activity networks to foster systems thinking, improve understanding of the existing landscape, and encourage action towards better policy and practice. Our mapping work has revealed some key gaps and opportunities where policies, programs, and prevalence could be improved. From the mapping work, we've developed an evidence-based guide for policymakers, Getting Australia Active 3, which aims to provide action-oriented guidance on implementing a systems approach for physical activity in Australia. However, ongoing stakeholder engagement will be central to supporting the translation of this work into better policy and practice in order to improve population physical activity. Thank you all very much for your attention.